Hi, everyone. I don't know who's here or who isn't yet, but I am. Can't get this live full screen here. Anyway, yes. So, welcome. We are in Puerto Rico right now. I am. I don't know if you can see here. There's the ocean. There's the ocean. Palm trees. It's really pretty. It's sunny. It's gorgeous. I hope people are having a great day. I'm here today over at the CanMed conference, learning a little bit more about cannabis, making some connections with some experts in the field, learning some stuff. It's really cool. But anyway, last week I was at Benzinga, which is more business related. So that's a lot of the investors and CEOs and stuff like that. I think it's important actually that those of us in the science field make sure that we're represented in the business end. We learned that the hard way in medicine, that if we're not doing business, we're not calling the shots in medicine. Then, it's part of the reason I don't do medicine right now. Well, I do medicine. I still have a hospice I work at, but yeah, the medical world right now is going a little bit crazy. So feel free to chime in with any Q&A. This is going to be an abbreviated one. There's a 4:30 lecture, actually. Well, 4:30 this time. Lecture I want to be in and see. So I'm going to have to dip out at 4:30. So if anyone's here, just hi, chime in. I think I fixed the problem we had last time where Restream wasn't posting people's comments. So anyway, that said, let's talk a little bit about cannabis. One of the things that really strikes me is we had some really good conversations today about, the medicine of cannabis and how there's like a bimodal sort of use that we find that low doses are actually really effective. Higher doses aren't. And then you get to some really high doses and people can start having effects, but they also have side effects with an increased risk of addiction and side effects and stuff like that. And I'm like, yeah, that's a medicine. And that's kind of the vibe I'm sort of getting. Yeah, cannabis is a medicine. It acts like a medicine. The fact that there are doses that are more effective. When you take your blood pressure pills, for example, a lot of your pills, there's a maximum dose. Why? Because after that maximum dose, it stops working. Or the risk of side effects start outweighing any of the benefit. But a lot of times it's because the curve kind of flattens out in terms of benefit. And there might be some truth with cannabis in that higher doses don't necessarily have much more benefit than a smaller dose. I mean, you're going to see it up to a point, but then that benefit flattens out. Now, when you're talking about chasing a high and stuff like that, yeah, then maybe a higher dose might have some benefit. There are some people who do need more. I mean, I see that with morphine. I have people who need only 5 milligrams of morphine, and it's enough to make them fall asleep. A half a codeine, which is equivalent to 2.5 milligrams of morphine, is enough to make them fall asleep and to control their pain. Then I have people who are taking 300 milligrams of morphine. So it can vary what people need, but you titrate to an effect and then try not to get more. The other interesting thing was they were talking about drug interactions. We touched on that in our last video where I was talking about drug interactions. Someone asked about the effect of blood pressure. I actually asked this question to the guy who was giving the lecture. Dr. Sulak was actually giving the lecture on drug interactions. And one of the things that we learned was that, or one of the things he said was that, yes, cannabis can cause low blood pressures, but usually it's smoked and usually it's fairly soon. And if someone's on blood pressures, much like I was saying before, if you're taking a blood pressure pill or something that can affect your blood pressure already, you want to start at the lowest possible dose and titrate up slowly. Start low, go slow, right? And work your way up into a dose that feels safe. That's going to be the best thing. And then, of course, if you're taking a blood pressure pill, monitor your blood pressure. And then there are situations like there are people who, with bad hearts, for example, where the heart doctor is actually driving your blood pressure super low because there's evidence that doing that is beneficial in certain heart diseases, certain heart failure conditions. And so giving someone that, yeah, especially if you're smoking, you might fall out. So if you've not done cannabis before, you have a reason to take it, you want to take it super carefully. Or if a doctor puts you on a blood pressure pill because your blood pressure is high, you want to be a little bit careful in the cannabis that you're taking after that. And of course, always, always, always talk to your doctor about your cannabis use. Not every doctor is very open to cannabis right now, and I know people get kind of scared about it. They're like, oh my gosh, the doctor, they're going to judge me. They're going to think I'm a druggie. They're going to think whatever. Or sometimes you do run into doctors who are like, cannabis. You have cannabis use disorder because you're using it. And yeah, that's out there. That's part of why I do what I do, which is I'm trying to get people to, understand that cannabis is a medicine and that doctors need to be aware of it, right? And so one of my target audiences is doctors that, yeah, you know what? This is not just some woo-foo stuff. This is actual, real, honest to God medicine. So I would suggest, talking to your doctor. And if they're not open, find someone else to talk to, either a cannabis doctor, someone who specializes in it, right? Some of the palliative care doctors know a lot about it, some of the onc doctors. So there's a lot of different doctors that you can talk to. And obviously, of course, throw some questions here if you got anything. But yes, and thank you guys for joining. Like I said, this is a little bit of an abbreviated, just sort of a check-in to see kind of, so that we're not leaving everyone in the lurch after last week and this week. I'll be back to my regular, normal schedule next week at this time, talking about cannabis and geriatrics and hospice. I've actually ran into a few palliative care doctors here, which is really cool. We were talking about that. And again, the vision to have a comfort pack of palliative care. So people at the end of life to be able to say, okay, here's your morphine, here's your Ativan, here's your medicine for constipation, and here's your medicine for vomiting, and here's the cannabis. And to say, you can use that with the morphine or without the morphine to kind of help with the pain. You can also use that to help with anxiety, right? And so that was just kind of an interesting thing. Some other things. Let's see, what else have we learned here? So we talked about the drug interactions, and part of the drug interactions that they talked about, much of it actually, is the fact that cannabis and CBD can both activate certain enzymes in the liver that will break down or slow the breakdown of other medicines. So they might increase the levels. However, what was very interesting that Dr. Sulek, who gave this lecture, was talking about was that the amount is usually not clinically significant. So if you have a drug that you take 20 milligrams of, and then if you don't respond, you go up to 40, so the difference of 20 milligrams is a clinically significant dose. So 20, 40, 60, 80, sometimes 20, 40, 80. Again, remember that little plateau I was talking about? A lot of times that's why you're going to see that. You'll see 20, 40, 80, because the difference of 20 no longer matters. Now you actually have to increase it again. So because the effect kind of plateaus out as it goes up higher. So in those types of situations, the increasing of the liver isn't going to increase it to a toxic dose. It might just increase it to 30 or 25, not even a clinical increase. Or it might, but it just might be within normal dosage. His point was there are certain drugs, probably the two biggest were the blood thinners of warfarin. And God, what doesn't interact with warfarin? If you've ever used warfarin, warfarin is an interesting drug in that it is rat poison. It's rat poison. That's how warfarin was discovered. They were using it to kill rats, and someone used it to try to unalive themselves and wound up in the emergency room with thin blood. And that's when people were like, what if we gave less than toxic doses of warfarin to people? You think we could thin their blood? And that's how warfarin was invented. And because we had a way of checking the levels, we could safely give warfarin to people, which is why for decades it was the standard of care for blood thinning until the more recent drugs have come on. And thank God for the more recent drugs. The warfarin was nasty because if the person ate a plate of greens, it was very food sensitive. So any type of not green vegetables like beans, but greens like collard greens or spinach would make the level go up high and just completely throw it off. Any drug interaction, antibiotics would make it go off because they would affect your gut bacteria and the absorption of vitamin K. And vitamin K is tied to the effectiveness of warfarin. So, not surprising, cannabis can throw warfarin off. So you need to really, 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 really monitor your warfarin closely if you're on cannabis, or talk about changing to one of the safer alternatives if you really need cannabis, or don't do cannabis if you really need the warfarin. So that's one side effect because it can increase bleeding. And the bleeding in sometimes with warfarin can be life-threatening, so no joke there. Then the other thing is it can cause interactions with tacrolimus. So tacrolimus, again, another thing that a lot of things it's very sensitive. It has what's called a narrow therapeutic window, which means too little and it doesn't work, too much and you start getting toxic. So tacrolimus is an immune drug that people use after they've had transplants. And it's very important, to prevent rejection in people who have had transplants. Now, what I often, not what I often, but what is sort of recommended for tacrolimus is if you're going to take cannabis and for whatever side effects you're treating or whatever reason, you want to make sure that your doctor knows about it and that they're testing your tacrolimus levels more frequently. And again, it's one of these situations where, depending on your indication for cannabis, maybe that's not the best choice for you because you really don't want to reject your kidney or your liver or your heart. That's not a good thing. You want that drug to work. So some of those are situations. And then you just want to be a little bit careful. Like I said, they did mention about the blood pressure. To say that, yeah, watch that. Just be careful. So that was some interesting stuff. The other thing was about the different types of what we know and the different ways we can take cannabis. I've seen actually someone presented a poster about it. Someone else talked about it. When I actually recently did a pain lecture a couple of weeks ago with some other doctors, they even chimed in that they were using it. And that is CBD, prominent, maybe with a little whiff of THC, what you might call full spectrum CBD. where it has just a trace of THC, has been in now several studies and in a lot of people's clinical practice, has been shown to be helpful for pelvic pain in women. So women who have different things that can cause pain down there, whether it's abnormal menstruation causing pain, or whether it's a lot of different other very painful conditions down there, that a suppository, and we're talking actually a vaginal suppository, has been shown to have some benefit in these women. Now, you have to make sure that whoever is providing the suppository has a way to make sure that whatever they're providing it in is safe, pH balanced, all that stuff. But it does seem to actually have some benefit in treating painful vaginal symptoms. And as I mentioned, even in the lecture when I talked about that, there was a doctor who specialized in pelvic pain, and she chimed in. She's like, "Oh yeah, no, I use that all the time." And then a physical therapist who also treated pelvic pain was like, "Nope, me too." So a lot of that's actually gaining a lot of traction. The fact that this sort of thing can help women with their different pelvic pains down there. The endometriosis is another one. People who have a lot of chronic endometriosis. But there's some theory that endometriosis might actually be tied to the endocannabinoid system. That's a development of it. Might be an aberration of the endocannabinoid system. I do hope that the sound's going good. I didn't really have a chance to test it here to see how it's going, but I'm hoping everyone's having a great day and things are going well. Let's have another little look here at the beach. Let's see just how beautiful it is. I've never been down to Puerto Rico before, and it's gorgeous. I've met with a lot of there's a lot of different research groups doing some different things. The other thing that I've seen is a lot of people working with the plant itself. Yesterday, I actually met the guy who helped, who published the article where they actually looked at the DNA of the cannabis plant and actually have the whole DNA now of the cannabis plant broken down, which is really kind of cool, because now we can say, oh, this does that, this does that, this does that. I at one point joked about would be nice instead of gummies if we could just take a CRISPR and make blueberries with a little bit of THC in it. That got a good laugh. But the guy who made the genome, after laughing, thought about it for a second. And he's like, yeah, but because the active ingredient is excreted on the flower of THC and the blueberry is the fruit, it's not actually going to work that way. And I'm like, oh, man, take all the fun out of it. No, it was a great conversation. It was very fun. Other things that we've learned. I'm trying to think so much. The brain's a little bit overloaded. It's part of the reason I seriously considered whether or not to come in. Now, I don't know. I at the last minute decided to do this video. So I don't know how many people are watching. And I'm doing it over my phone. So it's possible that I'm not getting anything over the phone, but it doesn't look like we have any comments yet. One thing I was saying on the YouTube, or not the YouTube, one thing I was saying on my post is I want to make something clear. Everyone keeps saying, oh, you have a podcast, Dr. Makela. It's a podcast. No, it's not a podcast. It's a live stream. And what's cool about live streams is that people actually comment on it. They actually, I put this little section for people to comment, and that lets me, I can talk off of that. What that means is I don't actually have a co-star. I don't have a co-host or a guest person visiting. You guys are the guest. You guys are the co-star. This is about the people who chime in and ask questions and our interactions. So that's what that is. Let's see. I'm trying to think if there's anything else really cool. I've met some geriatrics. There was a poster about geriatric patients and their use, and not surprising, we're seeing an increased amount of geriatric patients using it. But one of the things, of course, is there's not a lot of education to those geriatric patients on how to use it. So we're seeing less and less people know, how should they do it? And I've heard more than one case. I saw the cases in my own practice of people who came in and, told me, oh, yeah, I bought my mom, some cannabis to help with her Alzheimer's. And she slept for a day and a half. That was the one I had seen. But now I've actually heard several people talk about that they've had loved ones or patients who would come in and say, oh, yeah, we tried that. We did this. And oh, no, it doesn't work. It made her too sleepy. It made her too sick. She wound up in the ER completely hallucinating with psychosis and, because they took some just massive dose. Someone didn't know that you had to wait for gummies and did a back to back of 4 gummies all within a half an hour, someone's patient. That type of thing is not good. Now, if you don't know that, that's an important point. When you take oral, you have to wait. Oral medications take a while to process because you digest them, it goes into your stomach, but then it has to get into your blood. Now, one of the cool things is that not only does it get into your blood to activate, it has to go into the liver. And the liver actually converts it to 11 THC. And 11 THC is actually metabolically active and even just a little bit stronger than delta 9 THC. So that is why people will often feel oral medication differently than when they smoke it. Because when they smoke it, they don't get that conversion from the liver. They're only dealing with delta 9 in their system. In fact, today there was even this nice little graph that showed that you could get this really huge peak when you smoke and then it down, whereas you never quite get that big of a peak in oral because it kind of slowly releases it through your body a little bit. So you will get a peak, but it won't be as big as the peak with smoking. However, people will often have very similar responses to that. And that is probably because that 11 is stronger. So even though it's not as big of a peak, the 11 has a bigger effect when you take a medication like that. Now, I got about a few more minutes. I don't know how many people, I'm not sure if my talkback feature is working on the phone. It's also possible 2 weeks ago I was having some trouble that people couldn't comment on the phone or on the stream, and I actually worked with the technical people and found out what was going on and supposedly fixed it. But with me not seeing comments, I actually wonder if A, if anyone is watching, and B, if you're able to get through or not. So I apologize if you can't. Text me later or message me if you can't get through, if you're trying to type and it's not showing up on screen. I might still be having a problem with the thing, with the tech here. Who knows? Little cup of tea. So, yes, it's a beautiful day. It's warm. I have my little sun outfit on here. Instead of my regular reading glasses, I have my sunglasses on. Yeah. Now, let's see. Other things. Oh, the other thing we see is there's a lot of people talking about genetics and research and stuff like that with the plant. As I talked about the guy who actually did the DNA, there's a lot of people who are researching different aspects of the plant and like how it grows. One guy presented a poster about he created this device that created percussive effects on the plant to see how you could stress the plant in a systemic way, because certain types of stress can actually produce more cannabinoids. For example, a lot of people will create drought stress to have a certain effect on it, and possibly make a little bit more THC in it. I certainly see that with hot peppers. Obviously, it's a different mechanism of action, but in my hot peppers, if I forget to water them, I will get some super hot peppers because the plant thinks, oh my gosh, I'm going to die. And then it starts pumping capsaicin into the fruit to protect its only fruits. And so you get these super hot peppers. I've had jalapenos taste like habaneros because I forgot to water them. Now, what happens with this guy's study is he actually he created a little grid that created sort of percussive effects on the plant to see if the vibration percussive effects would stress, and indeed he did. And he plans to do more with that in terms of saying this is a standardized way to create this and da-da-da. But what was interesting is there's a lot of studies in the plant world about, does listening to music affect the growth of your plant? And they've actually looked, they're like, oh, classical music, European classical music, Indian classical music. A lot of people have listened to different styles and said, plants really like Bach, but they don't like, and they like heavy metal, but they don't like techno. And I'm like, but I like techno. I hope I'm not hurting my plants by listening to it, my tomatoes and stuff, right? And, but this guy might explain what's kind of going on a little bit, that the vibration indeed does affect plants. Something I didn't know. I'm trying to think if there's anything else really that's cool. There's been a lot of cool things. I got a couple more days where I'll be learning stuff. So when I'm back next week, I'll have a lot more to say. We'll do some Q&A. I won't throw it and surprise everyone with I'll be back in 2 weeks. Oh, look, nope, here I am. So I know that today we weren't expecting it. So I know people may have not had questions ready or had thoughts or even watching, because we didn't advertise today so much. But I did just want to check in, let everyone know, hi, we're still here. It's still going. And as next week, as we kind of come through stuff, we will have some more things to say. I do have a 4:30 lecture that I want to go in, the one on neurology. I skipped on the pain lecture that's going on right now to come here and talk to y'all, but I will go off and go see the neurology lecture, see if there's something new in terms of the research about how cannabis can help neurologic diseases such as MS or Parkinson's, and what the data is on. I'm very much looking forward to that one. I hope you guys all have a great week. And I will be back next week this time, and we'll have our full session. And I hope you guys have a great day. Take care. Okay. Come on, turn off. So sorry. Hello, everyone, again. We're just having a little technical difficulty with the phone and turning it off.